Hello, my name is Ellen Van Lint. Welcome to our Getting Norfolk Active training. Over the next 30 minutes, we'll be talking you through the benefits of physical activity and some local programmes and opportunities that may be of interest. Without further ado, I'm going to hand you over to Amy Story to get us started. Amy.
Hello. Okay, so Getting Norfolk Active. So who are we? So Active Norfolk is one of 43 active partnerships. We're hosted by Norfolk County Council and we're the strategic lead for sport and physical activity in Norfolk. What is physical activity? Physical activity is defined as any bodily movement produced by skeleton muscles that require energy expenditure. Physical activity includes all activities at any intensity, which can be done at day or night. It includes exercise and incidental activity, which is integrated into daily activity, such as walking to the shops, gardening, cleaning, etc. It is broken down into active living, which is things like housework, gardening, etc. Active travel, which could be walking or cycling to the shops. Active recreation, which is walking the dog. And then active sport, which can be informal or organised sport. Okay, the importance of physical activity. People who are active have lower health risks. For example, people who do physical activity are 35% less likely to get type 2 diabetes, 20% less likely to get breast cancer, and 25% less likely to develop coronary heart disease or have a stroke. There's also wider well-being benefits of physical activity as well. So in addition to physical well-being and mental well-being, these can be individual development. So the development of soft skills, which can impact your self-confidence and self-esteem. Physical inactivity contributes to 1 in 6 deaths in the UK, which is the equivalent of smoking. Up to 40% of many long-term conditions could be prevented if people were more active, and around 30% of later life functions limited and falls. And the estimated annual cost to the UK due to physical inactivity is £7.4 billion. So how much physical activity should we be doing? Okay, this is just the infographics which has been produced by the UK Chief Medical Officers. So the guidelines. So it should be making physical activity a daily habit, which can help prevent chronic diseases, improve mobility and balance, improves fitness, strengthens muscles and bones. It makes daily tasks easier and increases independence. By being active, it's easier to help maintain a healthy weight. So the guidelines say each week adults should try to do at least 150 minutes of moderate intensity activity or 75 minutes of vigorous, or a combination of both. Adults should aim to be physically active every day. 150 minutes may sound a lot, but it can be broken down across the week, and any activity is better than none, but the more is better. It's not just about being physically active, it's also about minimising the amount of time being sedentary, which means sitting down. If you do need to sit down, break up long periods of inactivity by some light activity, even just standing up and doing some squats or star jumps. An easy way to remember different types of intensity is, if light intensity, you should be able to sing when doing the activity. If it's moderate intensity, you wouldn't be able to sing, but you could still hold a conversation. And if it's vigorous, you'll be breathing so hard you can't speak. In addition to doing cardio and activity, you should also do some strength building exercises twice a week. So this just needs to involve using body weights or working against some resistance. So you don't have to go to a gym and lift weights. You can do simple things at home, like press ups against a wall or on the floor, yoga, weight training, but also things like carrying heavy shopping bags will count towards your strength building exercises. The greatest area of impact getting people who are currently sedentary, so doing less than 30 minutes of physical activity per week, getting them to do something. So as you can see from this graph, the greatest benefit is doing 0 to doing 30 minutes of physical activity per week. Obviously, ideally, we want people to do 150 minutes, but we say it's greatest health benefits are found from people who do 0, getting them to do something. In regard to risk management of promoting physical activity or undertaking physical activity yourself, exercise is great for most people. Obviously, there is an elevated risk of certain conditions. So if someone's got heart disease, they just need to be a bit careful. But obviously, health professionals can give further advice. The majority of people can do physical activity without visiting the doctor first. There's a certain points to consider before starting to exercise or increasing intensity. So current activity levels, if you currently don't do much, it's all about building up slowly. Don't suddenly try and go out for a 5-mile run. And also when you're exercising, just kind of keep an eye out for if you get any symptoms of certain diseases. So if you have type 2 diabetes, for example, you might just need to monitor your sugar levels before and after exercise, just to see how the exercise is affecting the levels. And also planned exercise intensity. It's good to build up slowly so you don't overdo it. So start slow and build up. It's easier to increase over time. Okay, so in regards to local opportunities, some of these opportunities are currently suspended at the moment due to COVID-19. But further details can be found by contacting the organisers or ourselves and looking at our social media. So Broadly Active is exercise on prescription, which is a 12-week programme delivered in North Norfolk, Broadland, Norwich City Centre and South Norfolk. Referrals are done through a healthcare professional, and once you're referred, Broadly Active will contact yourselves to arrange an initial meeting to go through kind of what you want to gain from the scheme and how you would benefit, and then they'll kind of tell you the weekly sessions which are available. There's loads of community-based classes out there, being in a community centre or a leisure centre or a school hall. So most communities will have something going on in the local area. Health walks, low intensity, short distance walks, which are available around the majority of the county, which further details can be found on the Active Norfolk website. And All to Play For is a football session for males who would like to improve their mental health. Again, this is suspended, but hopefully it'll be up and running again soon. So keep an eye out for further details on start dates. Okay, On the Move takes sports to a range of day centres across Norfolk. They're beginning to start up again now, so kind of keep an eye out to see if there is one starting up in a day centre near you. And Dragons Disability Real Action Norfolk, a group of Norfolk, are visiting collections, and they were published onto the Active Norfolk website, which can be found using the below link. So have a look on there, and if you have any suggestions for groups for them to visit, kind of again get in touch. Other opportunities, lots of smartphones now can track physical activity, and then you also have Map My Walk and loads of different walking apps, so you can track how far you're walking and the intensity and time. Active 10 is the sorry, excuse me. So Active 10 tracks how much walking you do, and it tracks the intensity you're doing as well. I Prescribe Exercise is ideal for people who can't access Broadly Active. It's an exercise on prescription app. So you type in some basic details about any long-term health conditions you may have, and then it gives a tailored 12-week program which you follow and then update through the app. In the course of 12 weeks, it increases the intensity. On the NHS website, there are a number of gym-free workouts which are ideal for people to do in their own homes. Through YouTube and different online platforms, there's lots of different online sessions, especially at the moment when things aren't back to normal yet. A lot of instructors are doing online sessions instead of doing sessions in community centres. So example online sessions, yoga, Joe Wicks has lots of different sessions he does on his YouTube channel. Couch 5K is a running programme over 11 weeks, which goes from people who don't currently run, getting them up to running 5K. And this, again, it builds up over time. It's 2-3 weeks, and it kind of starts with run, walk, and then builds up the distance. Okay, in regards to physical activity around the home, as I mentioned, the NHS have got lots of worksheets on their website. They've also got some fitness videos which cover aerobics, strength and resistance, Pilates and yoga. And they've got some 10-minute workouts as well, which can be just done through the internet. If you physically want to go to a session, Local Class Finder can help you find out what is available in the local area. You can search through the level intensity, the different sessions. If you want the instructor to have an enhanced qualification, there's lots of different filters on there. Again, it's also worth looking to see what is available at local leisure centres if you kind of just want to access the gym, and all the leisure centres kind of will run classes. Again, at the moment, this could be limited due to kind of restrictions, but have a look on our website and they'll give you all the latest information. Okay, Parkrun is suspended at the moment, but hopefully it will be opening again soon. Again, if you look on the Parkrun social media, it will give you updates. They're giving weekly updates at the moment on current situations. But Parkrun runs every Saturday morning at 9 AM and it's a 5-kilometre walk, run, jog. But also as part of Parkrun, there's also a lot of different volunteering opportunities as well. And again, you don't have to be a runner to be able to attend. A lot of people walk, they go as families, and there's lots of different ones in Norfolk. So once it does restart, kind of have a look at what's available in the local area. In regards to some other useful tools, as part of Moving Medicine, they've got some activity workbooks, which gives ideas on how to set goals, long-term and short-term goals. And it also provides an activity diary where you can complete what workouts you complete, or even if you go for a walk, you can keep a track of it. As part of Moving Medicine as well, they've also got a step counting pace up walking program, which monitors how many steps you currently do, and then over a course of a number of weeks, it gives you suggestions on how you can increase your walk number duration. And as mentioned, there's also the activity diary on there as well. As part of We Are Undefeatable campaign, there's lots of different ideas on their websites on ways to get moving, how to get started, and some case studies. So the campaign aims to help people with long-term health conditions such as diabetes, cancer, depression, to build up physical activity in their daily lives. So it's definitely worth having a look on their website to get some ideas on how you can get moving. I'm just going to hand back over to Ellen for her to do the final few slides.
Okay, so Amy's mentioned some stuff that you can find online and a lot of the information we have on the Active Norfolk website. Active at Home is a new page we've developed over the last few months, and there's lots of information about home-based activities on there. Active Outdoors is one that we've developed over the last couple of months as well, and there's plenty of information about walks and being active outdoors generally, so give them both a look. Your Health is information on how physical activity can help prevent and manage long-term health conditions. And also on the Disability and Physical Activity page, there's lots of information around how you can support individuals to access and improve physical activity in Norfolk. Our activity finder will be up and running again once activities are up and running also. The activity finder can be found on this Active Norfolk page. There's general search, and you can search by location and activity. So these are some contact details on here. My name's Ellen, as I said, so if you have any general inquiries, then do come back to me. I look after the On the Move project as well, so any queries or suggestions on the Move, I'd be great to hear from you. If you'd like to receive a full copy of these slides, then get in touch with me. If you'd like to speak to Amy for any more information around this training, and also Aaron is available to talk about any opportunities there are to deliver sport and physical activity yourselves, so that kind of training and any bursts of information. So that's it from us, and we hope you found this useful, and by all means do get in touch if there's anything else we can help you with in the future. Thank you.